Hi, I'm Stephanie, one of the social workers here at Michigan Medicine in the lung transplant program. We just wanted to tell you a little bit about what social workers do here in our program. So while the pulmonologists and the surgeons on the lung transplant team are making sure that you're medically ready for transplant, social work is here to partner with you and your caregivers to support you and help ensure you have what you need during all stages of the transplant process. We'll meet with you and your caregivers during the evaluation phase for lung transplant. In addition, once transplanted, we will check on you anytime you are admitted to the hospital for any reason. And we're available after transplant by phone, email, or through the portal. One of the primary things that social work will partner with you on is ensuring that you have people that are committed to caring for you at home right after transplant. Our program requires that you have a primary caregiver or a group of caregivers that will be able to stay with you directly after discharge, 24 hours a day, until the medical team feels that you are safe to be on your own. Because every transplant is different, we typically tell patients to be prepared to have someone stay with you for approximately 1 month after transplant. This can be one person or various people in a rotation. If you are having difficulty coming up with a caregiver plan, please reach out to us and we're happy to partner with you to create a plan. In addition, we want to make sure that you have reliable transportation and someone who can bring you for your lung transplant when you are called in for lungs. This can be at any time of day or night. It'll also be important to have transportation for all of your follow-up appointments and procedures such as bronchoscopies. If you're having difficulty identifying someone that can fulfill this role or finding reliable transportation, please reach out to us. Some insurance plans offer transportation benefit, so please reach out and we're happy to help you find a solution. It's very normal to experience depression and anxiety symptoms when being worked up for lung transplant. Social work is here to support you during this stressful time. We also want to assure you that we have many resources to help manage any mental health symptoms you might be experiencing. Lung transplant is intense, and many of our patients seek outpatient psychotherapy either with a transplant psychologist here or with a therapist in your local community. We're happy to provide you with referrals for providers in your area, either in person or via telehealth. Social work also collaborates with our transplant psychiatrist here at Michigan Medicine, who's able to help with any medications that might be helpful as you navigate the transplant process. Again, please reach out to us and we will help you navigate the mental health aspects of preparing for your lung transplant. We want you to know that mental health symptoms are normal and that there are many treatment options. In addition, social work will help you identify any needs you might have regarding substance use. These include treatment for quitting smoking, stopping any medications that are not permitted in our program, such as anxiety medications like Xanax, Valium, or opiate medications for pain such as OxyContin, among others. We can help you with referrals to a professional that can help you stop these medications and provide treatment for any substance use disorder. And lastly, our program requires that you fill out a document called the Durable Power of Attorney for Healthcare, or DPOA-HC.
I'm Amy. I'm the other social worker with the lung transplant team. Stephanie and I have the privilege to work with you and your family throughout your whole transplant journey, from pre-transplant all the way to and through post-transplant. We're available to support you both in the outpatient setting and anytime you may find yourself in the hospital, which includes at the time of your initial transplant or any hospitalizations thereafter. We will check on you and your family during hospitalizations to offer support and assistance as needed. Initially following your transplant, we will work with you in regards to the emotional recovery of transplant. We are here to support you and to navigate post-transplant life alongside you, whether that be through tangible needs such as assisting with local lodging or transportation needs, insurance benefits, or even helping navigating the Social Security disability system or filling out FMLA paperwork. There is also an emotional recovery component to transplantation, and we are here and committed to helping you and your family process this emotional toll. We understand and appreciate that transplant is a life-changing experience, and so we have developed multiple support networks to support you and connect you with others who have been down this similar journey of lung transplant. Every month, we hold a support group for both pre- and post-transplant patients and their caregivers. This meeting is divided into two parts. First, we have an educational component with a guest speaker speaking something in relation to lung transplant. And second, we engage the group to offer support, encouragement, and validation to one another. This is an awesome resource to connect with others who are on this unique journey of lung transplant. Additionally, we also hold a quarterly meeting for just caregivers. We identified a need for some space and time for caregivers to come together to share in their commonalities and offer support to one another. The final group we offer is a support group for just those patients with cystic fibrosis. This meeting is also held quarterly. You will find specifics about these support group meetings in your lung transplant binder or below this video with more information. We also developed a newsletter that is full of life stories and pictures submitted by other lung transplant patients, as well as other helpful resources. In addition to our support groups and newsletter, we offer a peer mentoring program where you have access to a one-on-one connection with other patients who have been transplanted at Michigan Medicine. These patients have been trained through volunteer services to offer support through phone calls, emails, texts, and even one-on-one in-person visits together. As social workers, we also appreciate and value the interconnection with Gift of Life. And we are here to support you navigating with your donor family, should this be something you choose to do. We are also here to help you process the emotional piece of choosing whether you feel comfortable connecting with your donor family or not. There are multiple layers in processing this relationship, and we are here to support you in whichever path you choose. You can locate our contact information in your lung transplant binder or below this video. Again, as social workers here with the lung transplant team at Michigan Medicine, we want to reiterate our commitment to being a support to you and your caregivers during and through your transplant journey.